Hello everyone, my name is Sabaa and here with me is my physiotherapist here at Ottobock Kenya. Can you please introduce yourself?
Yes, I am Becky. I'm a physiotherapist with Ottobock Kenya and with my very good patient, Sabaa. Hello!
Alright, so today I would like you to please tell us about post-amputation preparation. So after an individual gets an amputation, what happens next after that?
Okay. So I would call it post. You want me to speak about post-amputation or pre-post?
Pre-post.
Pre-post. Pre-post, yeah. Though basically most of the time when it comes to pre-amputation, it's not most of the patients who are aware that they're going to have their limb amputated, right? So most of the time, 80% of the patients are the ones who find themselves in hospitals after trauma or an injury, and the doctor just tells them, we are going to have to amputate your limb, or they just find that they have been amputated. So, as a physiotherapist, when it comes to post-amputation, most of the patients don't get proper information on what to do. Once they wake up, they find that they have lost their limb, whether it's their hand or the leg. They somehow just get treatment from the hospitals, wound care management, and then they go home. Maybe they get their prosthetic after some time, and they're told, we're going to give you a socket. At that particular point where they're getting their socket fitted, the stump is not shaped, or maybe the bone is protruding. Nobody gave them information on what to do. So the first and most important thing, once we get to have patients amputated or relatives or friends, it's important to walk them through the journey. People get depressed in the process. Sometimes they don't want to listen, sometimes they don't want to wake up from the bed, they want to sleep the whole day and night. I mean, it's true, it has happened to people. And counseling is important. It's the first thing I say. Let's have people counsel amputees. Let us get to a point where we can be able to understand them and know, I am approaching you not as an amputee, but someone who understands that amputation is a process. There's a healing process that comes with it, and we all have to be patient and of course do the right things. Once a patient gets amputated, of course there are so many things that happen.
Yes.
The wound has to heal.
Okay.
And shaping has to take place. For instance, I'll probably speak about leg amputations. Let's assume you've had your leg amputated maybe from here, and of course you will need to get a socket after that. After a week or two, there are people who experience phantom pains. I'm sure you understand what phantom pains are.
Yes.
Sometimes they can get so bad that the patient doesn't want to probably get out of bed or leave their stump. They keep on holding it like this. And phantom pain is a pain that is caused by a limb that is missing. So someone is amputated from above the knee joint, but they can feel their toes. Very painful. And I tell you, Sabaa, I'm feeling like my toe is almost breaking. And you're like, what do you mean your toe is almost breaking? You don't have a toe. Yeah, so most people don't understand it because they have not experienced it. So as a physio, we manage phantom pain through so many different things. First and foremost is helping the patient understand what is phantom pain. It's okay to have it because they still have their brain and spinal cord, and these things are responses from the brain and the spinal cord. So it's not like it's someone who has just woken up and started saying, oh, I feel like my toe or one of my toes is almost getting off, just like that. So we use mirror therapy. I don't know if you experienced mirror therapy.
No.
Mirror therapy somehow helps patients deal with phantom pain. We put the mirror
In between
the legs or maybe the hand, so that the patient sees the sound leg like that. So there's a reflection on this other side of this leg that helps you realize that I still have my leg there. So we can, at that point, I can tell you, can you feel your toes? Can you move them? Can you be able to do ankle flexions and flexions, things like those. Then, something like this, just a ball or cotton wool, something that you can be able to rub, deep tissue massages, slowly by slowly. It can be done by the patient, it can be done by the physiotherapist. Yes. So you do like circular rounds like that with a ball, or maybe you can use your fingers, slowly by slowly. Of course, if it's on the arm, then you can use the other arm. If you're bilateral amputee, you can get someone else to be able to do it. So the more you try to sensitize the area, the more it gets to accustomed that, there's a missing limb. Now I can only be able to use the residual limb that is left there. And so many things will happen. Sometimes you will put pressure on it and you feel like jumping because there are pins and needles and throbbing pain maybe on the distal end. But it's a process. You give it like a month, 2 months of continuous therapy, like maybe in the morning, in the evening, or rather lunchtime and in the afternoon. It depends. People have different responses to this kind of treatments. But there are also medication for phantom pain. The doctor definitely prescribes them for you. If someone doesn't get a prescription for medication for phantom pain, then you can always go back and tell the doctor, I'm really getting a lot of pain and I feel like my limb is still there, it's painful, or I just feel like my limb is still there, which is called phantom sensation. So those are basically two different kind of things. So
I've spoken with sorry.
It's okay.
I've spoken with someone before that the person said whenever he is cold, that is when the pain is more.
Yes.
So is there like a special medication for that, or like?
Well, like I said, every patient has a different experience. Someone will come and tell you, when someone puts pressure on me, I start feeling the phantom pain or the phantom sensation. Or sometimes they will say when it's warmer, it's when I get the phantom sensation or the phantom limb pain. So the kind of medication that is given for phantom pain and sensation covers no matter what aggravating factors you experience, whether it's cold weather, whether it's a lot of pressure, whether it's... So what we tell patients is, or rather amputees, I don't want to keep on saying the word patients because everyone will be like, but I'm not a patient, I just lost it, so I'm just an amputee.
I understand.
Yeah, so what we tell new amputees or even old amputees that have experienced or are experiencing this kind of things, if you realize you experience it when it's cold, try to make sure that your limb is covered, is warm. Put something, put a stamp saw, put whatever thing to make it warm. If you experience that when you have the warmth, is when you're experiencing it, remove it, expose it, and
put cold
yes. Yes. But don't put cold packs or anything warm without making sure that you have sensation. Because we also test for sensation.
So you don't burn yourself.
Yes. Especially for patients who have been amputated because of diabetes. Yeah.
So So thank you very much for that. So before a patient gets to use a prosthesis after amputation, is there like some sort of like special physiotherapy to do, or like a preparation? Or...
Yes. We call it pre-prosthetic therapy. It is the most important thing. I think everybody should know about it and how to do it. In fact, I have some notes here for after the amputation. You take one back with you, or two, you can give it to someone else, and we be able to assist other people. So,